Hello, everyone. I'm Dr. Carmen Pugliafito, and I'm here today with Professor Linda Lamb to talk about augmented reality. Dr. Lamb is professor of ophthalmology at the USC Roski Eye Institute at the Keck School of Medicine of USC, and is also clinical scientific director of Occutrex Corporation. So, Linda, welcome to Retina Synthesis. How are you today?
I am thrilled to be on Retina Synthesis today. I'm doing well. Thank you, Carmen.
So most of our work here on Retina Synthesis is talk about new retinal pharmacotherapies, but clearly we're going to need advanced technology to deal with our future clinical challenges. And augmented reality is something that we've all heard about, but don't know that much about. I think the average retina specialist knows little about augmented reality. What do we mean by the term augmented reality? What's encompassed by augmented reality?
Well, augmented reality refers to generally embedded technology that is able to sense and process and output data in real time and recognizes real world objects and provides contextual info by supplementing your human senses. So how is it different, for example, from virtual reality? Augmented reality is technology that overlays computer-generated context onto the user's world and enhances the real world where digital elements overlay the real world. So you actually still get your normal reality around you, but it enhances it. Whereas in VR, the user has an immersive experience and they actually do not see their actual environment around them. So the huge advantage of augmented reality is that the user actually sees everything that's in their real space, but the technology allows enhancement and direct overlay of contextual cues onto the real space of that user.
So how has augmented reality been used in the entertainment world or in other aspects of life?
It allows for immersive gaming experience, for example, in terms of entertainment. In the home improvement industry, IKEA and Lowe's and paint stores use it to overlay furniture, for example, in an environment so that you can see the environment, what the furniture would look like in the environment. And in manufacturing, for example, and in construction, you can actually have the wearable device where the user who's using it can pick out, for example, in the process, if there's a defect in one of the items, the AR device will be able to pick out the defective device. You can also do instruction manual. For example, if you're working on a car, you can put the AR device on your head and it will teach you, for example, how to change the fan belt in a car. And it's very important in terms of manufacturing because you can directly overlay, for example, if you're working on the inside of a car and trying to overlay which wires go where, the device can tell you step by step where to put the different wires and can sense things that are misplaced or not in the correct place in the manufacturing process and pick out those defective parts or defective processes and have instructional videos for people who are making the device or manufacturing.
What about medicine?
In medicine, the augmented reality has been employed in training, for example, in terms of surgery, allowing an overlay experience for surgical training, not just in ophthalmology, but in all the different subspecialties. And in addition to that, for example, it's replaced the cadaver in anatomy labs in terms of education. And then in terms of non-educational uses, the main use is in surgery, where it allows for 3D image of the patient scan, for example, directly on top of the patient's organ. For example, if I'm a heart surgeon, I can overlay the angiogram directly on the heart when I operate, so that I make sure that I'm excising the right vessel.
So what's the wearable that is the wearable different in each one of these applications, or is there some standard platform that's used?
So the wearable aspect, so for AR technology, you could have it not be mobile, but in general, the uh, when we talk about augmented reality, almost all the uh, technology is on a wearable device. There's multiple wearables that have been developed. For example, Microsoft HoloLens, Magic Leap. Google is developing their own AR device. And here at Occutrex, we have a wearable device that allows overlay for multiple situations. But our company has been primarily geared towards medical applications. So the AR technology can be in different wearables, but usually the software is usually specific to that particular wearable.
How widely used are these AR devices in the rest of medicine and surgery?
Uh, well, I would say AR is pretty much the future of where technology is leading healthcare. Um, it is used in surgical applications for um, many types of surgeries, including neurosurgery. It's becoming influential in terms of radiology, where the user can overlay AR technology on top of the scans and pick out the pathology. So I think of all the revolutions that is coming in technology and healthcare, AR is leading the way.
So what about ophthalmology? What is Occutrex working on? What is your vision for augmented reality in ophthalmology?
Well, there are many ophthalmic applications that are being developed in uh, in ophthalmology using augmented reality. Our company specifically have developed a device for low vision, where we can help someone who's visually impaired see what they couldn't see before by using eye tracking and pixel remapping to put the scotoma, the area that the patient cannot see, onto a healthy area of the retina on the device by projecting the image via eye tracking and aligning the image in the right place with the patient's scotoma dynamically every day. So that has low vision applications both in macular degeneration, myopic degeneration, and potentially glaucoma, and diseases such as retinitis pigmentosa in terms of low vision. We've also developed a device called Eye Lines, which is a device for amblyopia. Uh, that device allows dynamic customization of patching and therapy. So, as you know, right now, children are being patched with a bandage patch, and that does not allow for binocular integration. It also doesn't allow for dynamic daily customization of their therapy. So, what's important about Occutrex's asset in terms of amblyopia is that we've been able to, one, gamify the technology so that makes it fun for kids. We use icons that the kids like, if they're into dragons or if they're into Ariel from the Disney characters, we can put whatever character that they like and make games of it and get the patient to interact with the technology and really use it, because there's an issue of non-compliance with kids using the patching technology. And it also sends dynamic feedback to the patient's ophthalmologist in real time, and we can change the therapy daily based on how the patient is doing with regards to the amblyopia.
Well, can we talk a little bit about the low vision system?
Yeah.
My understanding is that you actually do perimetry to map the scotoma, you do perimetry with active eye tracking. Is that correct?
Yeah, yes, that is true. So what ends up happening is a patient wears the headset initially, and they go through essentially similar to a visual field test, but more in terms of the central vision, and where we map out the patient's scotoma dynamically every day potentially.
Hmm.
And the device is able to remember what the patient saw in each eye yesterday. And through eye tracking and our software, we're able to render the new where the scotoma is. We take the what's the image within the scotoma, and we map it into a healthy area of the retina for that specific eye for that specific day through uh, patented pixel mapping technology and through patented eye tracking. We are the holders of the patent for eye tracking in the AR space. And we've been working on this since 2013 when the founders, Michael and Mitchell Freeman's father, became blind from macular degeneration. And they made the first device to allow their dad to, quote, see again. And their father was able to ride the lawnmower, read emails, and watch TV again. Really changed the way he lived. And before he passed, he asked his kids to promise that they would put this device on the market for other people who had macular degeneration and severe low vision. So it's really changed the way I live because when I see patients who come in talking about suicide and hopelessness, we have something tangible in the near future that is going to come out and that helps patients be able to see their relatives, their spouses, and kids' faces again, to be able to watch TV, to read. It's been amazing uh, with our first trial, seeing how much patients were able to see after just the first sitting. They improved about 4 to 5 lines using it for the first time, and these patients put it on for about 10 to 15 minutes before they used it well. And these are patients who do not even have a smartphone and are not really acquainted with technology.
Hmm. Hmm.
So
What's the maximum size of the retinal lesion that you can work around? I mean, in terms of size of geographic atrophy or fibrodisciform scar.
So that is the $1 million question. We are working to answer that in our next trial right now. So I do not have that answer, but we'll have that answer shortly.
Hmm.
That is the first asset that the company has worked on in terms of low vision applications. And then I talked about the amblyopia device, but the the very exciting device that is coming out is the device that we've made for the operating room. Um,
Hmm.
First started working on what we call the OR bot and the OR lens, the surgery suite, because I had complained about how uncomfortable it is to do retinal surgery. And I talked to the team. They said, "Oh, really?" And so we investigated the prevalence of ergonomic issues in the surgical space. And a recent review in the Review of Ophthalmology journal showed that over half of our colleagues in ophthalmology have significant complaints about back, neck, musculoskeletal issues, and about 14% say that they reduce how much they operate because of these issues, and 7% of them retire early. So this is a huge issue, not just in ophthalmology, but when we talk to our vascular surgeons, neurosurgeons, every type of surgeon has uh, ergonomic where their work life is limited by posture and ergonomics. So that was the first problem we wanted to address with our device, but also um, space constraints was a big issue that I thought when you have heads up display, you have this monitor in the middle of your OR suite that takes up important real estate. And then third was visualization. I thought that in terms of the current technology and visualization with heads up display, it's not true 4K resolution. And wearing the 3D glasses actually uh, reduces the amount of light that's transmitted by over 50%. So our system is able to do the 3D um, rendering on the monitor without even using 3D glasses. So when you or your technician or your students around you look at the actual monitor, it's in 3D and you don't have to wear any glasses.
Hmm.
So
Yeah, that's a radical difference. I mean, all of us are. How do you get away from using the three-dimensional glasses that we use with 3D TV and 3D movies?
it's patented technology that I can't reveal exactly how we do it, but we are the only company that's able to do this with our resolution is 60 pixels per degree. That is the
Hmm.
highest resolution that your eye can see, and we are the highest resolution in all of augmented reality
Hmm.
that on this earth right now. We so our surgery suite of the future has um, three different ways that the surgeon can visualize the surgical space. One, you can use the microscope where there's oculars that come up to you. When you sit down, the oculars actually know where you're sitting, and the oculars come to your eye and it adjusts depending on your posture. So let's just say I start slouching, with the microscope, I have to keep repositioning so my oculars are still centered. When I start slouching, our OR bot surgery suite, our the cobotic arm comes to you and actually um, changes the position depending on where you are. So there's digital feed uh, in the oculars that you can use. That's the first way you can visualize it. And the second way that we had alluded to is using the 3D monitor without any 3D glasses.
Hmm.
Sit back and be in a comfortable ergonomic position and operate. Whether you're doing eye surgery or any type of surgery, you can just look up on the monitor without any 3D glasses and be able to see in 3D, high 3D resolution. And I have been able to operate and peel membranes with the 3D display several
Hmm.
weeks ago, and it's amazing. The third way of operating with our surgery suite, I think, is the most innovative, is using our OR lens surgery headset. And that's a headset where you put on um, the headset and it allows for a digital overlay. Um, for example, I could have OCT, we're working on putting OCT data in the headset. You can bring up just through uh, looking with your eye gaze. For example, if I want to zoom in, I can just lean forward a little bit, and that would allow the zoom feature to be activated. If I gaze in different directions, and it would allow different med tile displays. For example, a previous angiogram information for the cardiac surgeon, or different different patient information, and that's customized for the surgery and the surgeon, and it can be and this allows for very high resolution um, mapping on top of the actual real world. So you're able to actually see the patient, whereas there are other surgery devices that we've used in the AR space that are purported to be AR, but when I used it, it was obscuring too much of the actual um, actual. It was obscuring a lot of light, so I was not able to see the surgical space that our device is able to.
Hmm. Hmm.
And we have something called dynamic opacity. Our device, both the OR lens and the OcuLens, and all of our AR devices has something called dynamic opacity. So we have an algorithm in software that actually detects the ambient light surroundings of the user. So, for example, if I'm in a very bright space and I'm a cataract surgeon, I have the room lights on, but I'm operating and trying to do phaco. Um, the the OR lens will know that you're in a bright surrounding, and it will actually make the area that you're looking into darker with the background, but allowing you to see everything around you. So
Hmm.
we have it is dynamic opacity that allows us to actually use the device to become a virtual reality device, meaning have it be completely immersive if we wanted to. So technically,
So,
what we call X, it allows AR and VR to be used.
so when do you think the OR bot, your augmented, your AR bot is going to be available?
We're planning to premiere it next year um, at the Frankfurt Retina, but I am not sure when it's going to be FDA approved. So
Hmm.
I would say within the next year or two. The OR the OR bot system will require FDA approval, and we're already set up teams around the globe, surgical teams to carry out our clinical trials.
What
And
about the macular degeneration system?
so for the AMD device or the OcuLens, we're planning to have this be available by the end of the year, 2021. Um, Taking into consideration that with the pandemic, it's led to issues with supply chain and so forth. But we are anticipated to have this available by the end of 2021.
Hmm. Hmm. Well, this has been a very exciting conversation. Um, do you have any final words about what we should be on the lookout for as retina specialists?
Oh, in terms of AR and in terms of technology, I think as retina specialists, well, for example, this device does telemonitoring. The device will be able to tell you whether the patient is having a change in their scotoma. And I think that's going to be very revolutionary in terms of the patient not having to come in every X amount of time to monitor their AMD. So, because of these telehealth reimbursement codes that have been employed due to the pandemic, there's been a huge adoption of telehealth amongst not just ophthalmologists, but in many areas of medicine. And so I do think telemedicine is going to be much bigger in ophthalmology and in retina. And I do think AR is going to really drive what's going to happen in medicine in terms of not just education for our surgeons and being able to remotely collaborate. Like for our device, you can actually I can put on the device and do a retinal surgery, and someone who's coined a new, for example, macular hole procedure can be using their device at home in South Africa, for example, and be able to teach me just through gesturing because they have the same view as I do in real time because our latency of our device is less than 10 milliseconds. Um, in real time, that surgeon will be able to tell me through gesturing, oh, peel the membrane here. And I'm in the operating room and they're just at home and they have the same device on. That is just going to change how we treat our patients, how we make surgery and treatments safer, and change the whole face of education in medicine. But we can also do patient education as well. The device allows for monitoring of aspects of the body outside of the eye. So you can actually use our device outside of ophthalmology. So I'm just really excited at how technology is going to change our lives. And I think the pandemic has really propelled the adoption of technology in healthcare. And I'm really excited about how we can help patients who used to be severely visually impaired have hope and have productive lives.
Okay. Well, thank you so much, Linda. Have a good day.
Hi, Carmen. I appreciate it.